The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD Warriors, for another episode of TMD Demystified. I am Tony Urbanic. It's Tuesday, which is episode day, recording day, and this episode is going to be entitled Why Insurance Companies Don't Want to Cover TMD/TMJ. Basically, why insurance companies don't want to cover what you have to do in treating TMD. I have a long history that goes back roughly almost 50 years since I started treating TMD surgically for the first 36 years of my career. And I can talk about that. Most of my time today will be spent talking about why they don't want to cover it non-surgically. But let's cover the first 36 years first. In that temporomandibular joint surgery from an oral or maxillofacial surgeon was disrespected, tried to avoid coverage by insurance companies in any way, shape they could, basically the entire 36 years. Now, depending on the type of coverage, type of insurance company, I'll try to avoid using most insurance company names. But as a surgeon, I dealt with this entire career. But what I can tell you for sure is that if there was to be any coverage on surgery for the temporomandibular joint, it would never be covered under dental coverage because it wasn't considered dental. It was considered medical, quote, medical insurance, medical surgical insurance, because this joint is just like any other joint in the body. And if the insurance company, one way or another, finally conceded that they were going to cover it, it was always covered under medical and not dental. But my experience over those 36 years is the insurance company squirmed and squealed and used all kind of excuses, most of them not justified, almost all of them not justified. The most common one was it's experimental. You know, that can be debated. I don't want to go down that rabbit hole. I can speak for an hour or two just on that. But according to the science or the experience that had been given in oral and maxillofacial surgery papers and textbooks, no matter how well the science had been done, and some of it was pretty good science, the justification or excuse from medical insurance companies was always the same, was experimental. So we won't take that any further, but go forward now 36 years to roughly 14 years ago when I first developed and discovered really what was going on with temporomandibular joint problems, which was not necessarily, having to do with a particular device, although this particular device handles the cause, not the symptoms, by taking the load off the temporomandibular joints and decreasing inflammation. And inflammation is the driving factor. If you can decrease inflammation within the temporomandibular joints, the symptoms disappear over time. Some of them very rapidly, some of them take a little longer. But that was my discovery of sorts. It wasn't that I discovered a device. I discovered that inflammation drives all the symptoms. Now, if you have a magic wand that takes away the inflammation, I would encourage that. And this is about as close to a magic wand as I'm aware of and that we have so far. And that is, if you unload the temporomandibular joint by disoccluding the posterior teeth according to a protocol, then you will get the results. The device itself is a tool. If you use the tool correctly, you'll get the response. Now, back to the topic. So 14 years ago, this all began, and I entered this rabbit hole and actually found the same response from insurance companies that they did not want to cover a non-surgical treatment for TMD. Now, just for completeness and not to confuse, but I think everyone in the dental community, if you are a dentist, acknowledges and knows that if you make a night guard, that is going to be covered under dental insurance, because a night guard's only purpose is to cover the surfaces of the teeth to protect the teeth. So that makes sense. It's logical. And you will get the usual, roughly, it's been that way for past 20 years. You put in a claim for a night guard and you'll get $400 and off you go. But a night guard does not treat temporomandibular joint problems. A night guard protects teeth, although the night guard in 50% of the dentists in the country is used for the treatment of temporomandibular joint problems inadvertently, incorrectly. And most dentists actually know that a night guard doesn't treat TMD and is of no value in treating TMD, but that is the usual and customary treatment for TMD that is out there, and then it goes back 50 years. But again, getting back to the point of why insurance companies don't want to cover TMD non-surgically, there are actually 4 reasons that I've come up with I want to share with you, and then I want to share with you our particular story in this practice, which will confirm some of the 4 points. But no doubt that when it comes to medical insurance, they don't want to cover non-surgical treatment of the temporomandibular joint. They do everything they can to avoid surgical treatment of the temporomandibular joint. They just don't want anything to do with it. And basically for these 4 reasons. The first one is self-evident, but developed over decades of observation by dentists, by physicians, by the patients themselves, and especially by insurance companies. Insurance companies are not dumb. The people that work there are very bright. By the way, insurance companies, the purpose of an insurance company is to make a profit for themselves and the people who invest in insurance companies. That's their purpose. Their purpose is not to help people, although their PR and their slick advertisements are geared to making you feel like they are doing things to help you. Their purpose is to make a profit. So number one is insurance companies know, just like dentists, physicians, and patients know, who have the problem and have gone down multiple routes to try to fix it and help delineate and diminish the symptoms, that nothing works. And that's the consensus. And that's the consensus among the doctors, the dentists who use night guards. They know nothing works. They use the night guard to get the patient out of the office and hope they don't come back. But the consensus of insurance companies is nothing works. How do they know that? Because over the years, whether it's been their experience or experience by other insurance companies who have attempted to have partial coverage for non-surgical TMD problems, that the patient does not get better. So they don't want to cover things that they know aren't going to work. Self-evident. The second reason that insurance companies don't want to cover TMD is the multiple theories out there without success. There are just, whether they be surgical theories, and I can attest because I have, as an oral and maxillofacial surgeon over 36 years, performed over 2,000 temporomandibular joint surgeries, half of them through an arthroscope, but a little more than the majority of them open joint surgeries, making an incision in front of the ear, going into the joint itself, and doing whatever the procedure was on the joint, from removal of the disc to pulling the disc into proper position, to total joint reconstruction and using various types of implants into the joint itself. I've done them all. There is not a type of surgery, a classification of surgery that I have not done hundreds of times. Admittedly, some of them are fairly useful. And the reason I quit doing surgery was that 30 and sometimes 40% of the patients would be back within a year or two with complaints again, and I had already performed surgery. And after doing that too long, I finally decided I couldn't look my patients in the eyes at the time of consultation and tell them I was going to do something that was going to fix their problem when I knew 30% of the time, the odds were 30% of the time they would be back within a year or two with symptoms again. And that's when I went off and did my own independent research to see if I could figure out what had been missed, because there's always a problem. There's always a solution to a problem if you know where to look, if you know where to look and what to do, if you know the right questions to ask. So the multiple theories, surgically and non-surgically, that are out there that really have no significant validation, do not have scientific analytical structure surrounding them, is well known, whether it be non-surgical or surgical. And insurance companies, again, are not stupid. They're out there to make money. And if they're paying for multiple procedures or multiple devices or multiple treatments that are not effective, and the patient keeps circling back and circling back and circling back to a particular provider or multiple particular providers, and they keep getting multiple bills, claims, and that nothing works, then they eventually will say, and won't take them long, we don't want anything to do with TMD. That is a fact. That is fact number 2. Fact number 3 is that when it comes to TMD, TMJ services, there is no standard of care. There is no standard of care. Now, let's delve into, because of my experience as a surgeon, I can tell you that the American Association of Oral and Maxillofacial Surgery publishes a standard of care for temporomandibular joint surgery. That is according to standard of care, according to the American Association of Oral and Maxillofacial Surgeons. But surgeons are biased, and I can tell you that the majority of my colleagues who continue to do temporomandibular joint surgery, because the vast majority of oral and maxillofacial surgeons no longer even try to do temporomandibular joint surgery. Back in the 80s and early 90s, I would say the majority of trained oral and maxillofacial surgeons were attempting to do a significant amount of temporomandibular joint surgery. But in the 90s, because of various reasons, and the same reasons that I began to see with patients coming back, no matter what I tried and what I did, now in 2024, it's extremely hard to find an oral and maxillofacial surgeon who will even attempt to do temporomandibular joint surgery. But the American Association has standards of care that they have come up with, but they are very biased because they're surgeons, and they attempt to apply these to the very few number of oral and maxillofacial surgeons who continue to do surgery and are very biased toward surgery. I mean, there's nothing wrong with being biased, but you have to back it up with scientific data. And the scientific data on which or what kind of temporomandibular joint surgery can be successful is slim to none. Slim to none. And if you actually read the studies, they themselves are very biased. Now, when it comes to non-surgical standard of care, there is none. But circling back, just before I leave it, the American Association of Oral Maxillofacial Surgeons, in their standard of care, do make a simple comment about when temporomandibular joint surgery and under what circumstances temporomandibular joint surgery should be attempted. And their simple statement is that before temporomandibular joint surgery is to be attempted, conservative treatment should be done. You should do conservative treatment. But there is no standard of care on how long or what type of conservative, meaning not even defining what conservative is, just conservative treatment. And you can, if you wish, define conservative treatment in just about any way you want to. Soft diet would be conservative care, but you don't have to tell a patient with TMJ problems to limit the amount of chewing they do. They do that automatically. So that would not be, in my mind, conservative treatment. It would just come normally with having the problem. But the point is, again, the standard of care for non-surgical treatment, quote, conservative treatment, does not exist. And as far as standard of care in dentistry, there is no standard of care in the profession of dentistry on non-surgical treatment of TMD. That is why whatever the dentist feels is the right thing to do about TMD is the thing that he will do, whether it be a night guard or nothing at all, or some wild treatment that stands no validation analytically or in experience. And the fourth fact is that insurance companies are well aware of what I term, and I stick by it, the TMD gurus. There's a small number of TMD gurus in every city who use basically smoke and mirrors to treat TMD symptoms and then try to validate their treatment by gaming the medical insurance company CPT code system. They come in different varieties. I've had experience with many of them, starting out with consultations and exams that can last as long as 4 hours, and attempts to validate what they're doing by supplying a medical insurance carrier with a stack of consultation documents a half-inch thick. And everything under the sun about, review of their symptoms to using monitors and machines and myofacial dysfunction myomonitors, all trying to use a CPT code to validate not only the consultation, but then whatever treatment. One of the most common ones that I've seen and I have dealt with directly, and I don't want to go into that today, but there was a provider here in Nashville, Tennessee, who had a protocol that he used for patients with TMD. He was very well known, and the protocol was to, quote, recapture the disc or meniscus by pulling the mandible forward with a series of oral devices, both upper and lower oral devices over time, literally distracting the condyle out of the fossa and trying to bring it under the anterior displacement of the meniscus or disc. And that procedure and that theory is still being used throughout the country, and mandates after you pull the mandible out of the condyle and hold it there long enough, then you develop a malocclusion, a significant malocclusion, a significant class 3 malocclusion. Then the occlusion has to be totally changed, either operatively by crowning crowning every tooth in the mouth, basically 28 teeth, or orthodontically moving teeth adequately to accommodate for the malocclusion that was just created. That was the mechanism. That was what was done, and costing tens of thousands of dollars over a period of usually a couple of years, 2 to 3 years. And the average fee to do that was, as I understand it, $40,000 to $50,000. And I will just add that I continue to see patients from that practice who have TMD symptoms and come to me for help, come to our practice for help. But that is one example of the many doctors out there that I consider TMD gurus that use unusual methods that they call conservative to pull the mandible out of the glenoid fossa, and ended up not helping the patient, but especially using unusual definitions and values to CPT codes to game the medical insurance company system and CPT codes system. That is, CPT codes different from dental codes. And the insurance companies are not dumb, and they know this. And that is the biggest reason why insurance companies do not want to cover TMD, TMJ, because they don't want to be gamed, and they are in the business to make money. That is their purpose for themselves and their shareholders. And they don't want to get involved with anything that doesn't allow them a reasonable chance of doing that. So those are the 4 reasons that I came up with why, and they're facts. Those are facts that I gave you, why insurance companies don't want to cover TMD. And then I'll share with you our own story here that came about once we began treating patients with this device, which we had to call the Urbanic device in protocol, because the patients wanted to call it the miracle device. When we did a survey of all our patients and did a little survey from them, and what should we call this thing? And we couldn't call it couldn't call it what the patients wanted to call it, which is miracle device, save my life device. And I had to fall back, unfortunately, and just use my name. But our experience after a time when we began seeing an increased number of patients who came in for help and using this device, I began claims to Blue Cross Blue Shield, which is the largest insurance company by far in Tennessee. Blue Cross Blue Shield covers roughly, without knowing exact, somewhere between 70 and 90% of the lives in Tennessee. And I was contracted with Blue Cross Blue Shield as a oral and maxillofacial surgeon. And when I began excluding surgery to treat the temporomandibular joint and began treating it non-surgically, I, being familiar with CPT codes and knowing that the temporomandibular joint is a medical surgical problem and not a dental problem, I decided to, for my patient's sake, make claims to Blue Cross Blue Shield for the treatment with this device. Now, there is no CPT code for the Urbanic device, and I was aware of that. And so the usual convention is, if you don't have a CPT code, you choose the CPT code that is closest to the service you are providing and supply that. And that is exactly what I did. As an oral maxillofacial surgeon and doing literally a couple thousand orthognathic cases, I would always make a orthognathic splint, which was used in every orthognathic case, to provide starting points for when you cut up the maxilla and mandible and repositioned it correctly. You had to have a starting point, and that starting point was developed by using what was called a surgical splint. And a surgical splint, by someone who is not knowledgeable about orthognathic surgery or even temporomandibular joint surgery or even trauma surgery, which I used lots of splints in trauma surgery, there is a code for an orthognathic splint. There's a specific code for a surgical splint. So instead of using a non-surgical code for the Urbanic device, I used, by convention, the code for a surgical splint. And the number of patients who benefited by our treatment began to explode almost logarithmically. I mean, we went from doing 2 a month to 2 a week to sometimes 6 or 7 a week. And it did not take long before I start getting letters from Blue Cross Blue Shield saying, "What are you doing?" And the answer in return was always, "Well, this is a non-surgical device, but it is a device similar to and is used in the mouth like a surgical splint in between the teeth, and it is the closest CPT code that can be used." And so, without going into a lot of detail, I went round and round. My insurance manager went round and round with Blue Cross Blue Shield over a period of 2, 3, going on 4 years, with them saying, "Well, this is inappropriate. You can't use that code." And then the response was, "Okay, what code would you like us to use for this medical treatment using a non-surgical device?" And basically, after 4 years, because of my contract, I had the option to call a meeting, literally a person-to-person meeting about this issue. Basically, they kept saying, "Well, you can't," but kept paying the bills. And I say, "Well, yes, I can. That's the convention." And so we called a meeting in here in Nashville in my conference room where the chief medical officer, the chief attorney for Blue Cross Blue Shield traveled from Chattanooga, Tennessee, along with the chief medical officer, 2 executive Blue Cross Blue Shield representatives from Nashville, my attorney, and myself in our conference room, at which point I went through my findings on discovering not necessarily the device itself, but what was really going on with temporomandibular joint problems. That's all driven by inflation, by the inflammation within the temporomandibular joint, and laid it all out how they could avoid actually doing a lot of surgery, because we were avoiding, I mean, there weren't any cases at all that I would do surgery on before that I would have to do surgery on at the time once we began using this device. The device was avoiding hundreds of $1,000s worth of charges for surgery, and you don't need an MRI, avoiding just in our practice hundreds of MRIs, and if you extrapolate that into multiple practices, millions of dollars of MRIs, looking at where the disc is and how much damage is in the joint. You don't need an MRI to do a non-surgical treatment using our device, and explain how many millions of dollars they could save, how well the device worked, why it worked as well, our studies showing how well it worked. After I finished my presentation, the chief medical officer looked at me and he said, "Dr. Urbanic, I can't argue with anything that you presented here." And after he said that, the attorney in the room from Blue Cross Blue Shield made it very clear that there was not going to be a request for a CPT code. There will never be a request for a CPT code for a non-surgical TMD device, whether it be my device or any other device. And at that point in time, there's a female attorney. She made it very clear that the money that they had paid on those claims would be, as the word goes, clawed back, have to be paid back. So without getting any deeper into the explanation. My attorney made it after and then literally she and the rest of the people in the room got out of the room and walked out. My attorney was very clear in that they did not come to negotiate or to find out about what I had done. They had only attended the meeting because my contract with them allowed me to call a meeting and explain and discuss the matter. And they did that, and then they walked out. So actually, they did us a favor at this point in time. It's a cash-only service. It has no CPT code. It will never have a CPT code. A non-surgical device for the treatment of TMD will not have a CPT code. And that's just the way it is. So that is my best description and rendition of why insurance companies don't want to cover TMD and TMJ, even though they could save literally millions of dollars by avoiding surgery and avoiding a lot of smoke and mirrors and a lot of TMD gurus trying to game the insurance company. That could all be avoided. In a very short-sighted way, they do not want to cover TMD non-surgically by simply saying there is no CPT code. And I'm sure, although I have not attempted to put a claim in for surgical TMD surgery in 15 years, I'm sure they're still attempting to try to avoid any kind of surgical coverage that they possibly can by making any excuse they can. So I hope that is meaningful to you, whether you are a current provider for the Urbanic device and protocol, or whether you're considering becoming a provider, or just you are interested in TMD and you'd like to help your patients. And that is the reason we do this. That's the reason I do it. It's the reason we have a company that has developed a network of providers throughout the United States who are licensed to use the Urbanic device and protocol. Whatever part of the game you are playing, I hope the information I just gave you is helpful in understanding this, because the second most common question that we get from patients is, how come my TMD device is not covered by my medical insurance? That is the second most common question we get about the device or our services when the patient is here in consultation. And then the most common question, as I've already talked on before, a separate episode on that, which is usually questioned and delivered the question after the patient wears the device for a while, and that is, how come nobody ever told me about this before? I've had the problem for 10, 20, 30 years. How come you never told me there was actually a solution? That is the most common question we get from patients. Second most common question at the time of consultation is, why isn't my device covered by medical insurance? Well, hopefully now you know why. Hopefully it makes sense to you. I hope. If not, make some comments. I'd like to hear your comments. I'd like to hear criticisms if you have some. I'm open for criticism. I can be reached at tony@tmjservices.net. If you'd like to learn more about becoming a network provider, the quickest and easiest way to learn more and actually to ask to become a network provider would be on our website, which is urbanictmj.com. urbanictmj.com will get you to our website, and on that website is a drop down where you can ask to become a network provider. If you'd like to contact our chief operating officer and director of marketing, that's Dr. Naomi Williams. She is the operating officer and keeps all of our network providers current and with information and takes care of their issues. She can be reached easily at Naomi@tmjservices.net. So for that, that's it for today. I look forward to next Tuesday when we'll meet again, and I'll choose another topic about TMD to hopefully enlighten you and get you interested in treating this problem for the benefit of the millions of patients, primarily women, who daily have these symptoms ruin their lives. For today, I am Tony Urbanic, and this is TMD Demystified.